The eyes are perhaps our most important facial features. They are our source of vision. But not only that, the eyes are actually the mirror of the soul and have the ability to show our feelings and emotions to greatly influence our overall facial expressions. Blepharoplasty, as we call it, or eyelid surgery, can have extremely dramatic results. Restoration of a more youthful appearance of the eye and a less fatigued look can dramatically affect one's facial aesthetic appearance, perhaps more than other facial cosmetic procedures. Unfortunately, the eye area often shows the earliest signs of aging. The upper and lower eyes may develop bags, folds, wrinkles, and can add years to one's appearance. They may be swelling and puffiness, especially in the morning, that gradually becomes more permanent, and there is often a lowering of the eyebrow line. However, these problems are not just age-related, they can also be hereditary in origin. Aesthetically, they might be visually unattractive and create an unnecessary or premature impression of aging. In some cases, the upper eyelid can also sag sufficient to actually impair vision. Blepharoplasty is a surgical operation designed to remove the excess of fatty tissue, muscles and loose skin in order to achieve a more youthful, wide-eyed look. Every year, 100,000 men and women and more choose blepharoplasty to improve the way they look. Eyelid surgery cannot alter dark circles, fine lines and wrinkles around the eyes, nor can it change sagging eyebrows. Though blepharoplasty is often performed as a single procedure, it may be combined with a brow lift, facelift, skin resurfacing to achieve the best possible result. As with all facial plastic surgery, the best candidates of blepharoplasty are patients with good health who are realistic in their expectations. The operations are usually performed under twilight anesthesia, which ensures that you will be relaxed and peaceful during surgery. General anesthesia also can be used if preferred or if necessary. The procedure itself takes about an hour or sometimes more for either upper or lower blepharoplasty, depending on the individual cases. If local anesthesia is used, a day's stay in hospital will be sufficient, whereas with general anesthesia, a one-night stay will be required. Most commonly, the surgeon will make incisions along the natural crease of the upper eyelid and just below the eyelashes for the lower eyelids. The upper eyelid incisions extend from the upper inner corner of the upper eyes to the crow's feet region. The surgeon will remove excess skin, muscle and fat as necessary to produce the desired result. The incisions are then closed with extremely fine sutures, which are often removed in about a week. If the lower eyelids are being operated on, a transconjunctival blepharoplasty may be performed when excess skin does not need to be removed. This procedure entails a small incision only on the inside of the lower eyelid. This allows the removal of fat pockets in the lower lid and prevents any visible scars while still producing an excellent result. There may be some discomfort and some swelling and tenderness and bruising of the eye area must be expected, but this is only temporary. In some cases, the eyes may become dry and somewhat irritated, in which case it's probably best to apply an unpreserved lubrication tears or lubricating ophthalmic ointment. Dark glasses are allowed immediately so one can proceed with one's normal routine as soon as possible. Postoperatively, care instructions are given by the surgeon, and these must be carefully followed to ensure the best results. Between 4 to 7 days postoperatively, the stitches will be removed. The patient usually returns to work after 1 week, as makeup is allowed after stitches has been removed and most of the swelling has subsided. After the first couple of weeks, you will begin to see the real aesthetic results of your surgery. However, you won't have your best results for up to 6 months following surgery, during which period the incision's line will fade with slightly pinkish color to nearly invisible thin white lines. The results are often dramatic and in most cases would last for many years or even a lifetime. Blepharoplasty is a relatively safe and effective operation when compared to many more widely invasive and aesthetic surgical operations. The vast majority of patients, I would say, who undergo cosmetic eyelid surgery are extremely pleased with the results. Infection is a risk with a very low incidence, and any type of surgery can happen, including surgery in and around the eyes, but it can be easily treated with antibiotics. Bleeding after blepharoplasty is rare and may require reopening of the eye wound and cauterizing of the bleeding vessel or evacuation of the clot. The edge of the eyelid skin closure may separate, especially in the first day or two after suture removal. A small separation may be closed spontaneously or with the help of supporting tape, while larger separation may require suturing. Tiny white cysts may develop in the suture line, while most disappear without treatment. Removal of a resistant cyst is simple and quick. Blurring of vision and double vision are temporary that can occur in less than 1% of surgeries. Inability or difficulty to close the eyes is very rare indeed. Condition usually temporary. In rare cases, corrective surgery is required. Complications of anesthesia can happen with any type of surgery, and as a routine, we regularly check the health of the patient prior to surgery. Suitability of this type of treatment, as with any other treatment, will be assessed by the surgeon at consultation, but is based on several factors, such as the quality and elasticity of the skin, the amount of fat required removed, the general condition of the patient, past and medical history. The specifics are best discussed with the surgeon for a complete understanding of the potentials in any individual case.